In any health facility, sepsis is the most important cause of neonatal death. Therefore, it is very important for each hospital to take necessary steps to prevent neonatal sepsis. The first and the foremost important step in prevention of nosocomial infection is hand washing. According to the WHO recommendation, hand hygiene with soap and water should be done for about 40 to 60 seconds, and hand hygiene with an alcohol-based hand rub should be done for about 20 to 30 seconds. Before entering into the baby care area, one should remove the shoes, the socks, the woolens, the watch, the bangles and the rings. Roll up the full sleeves to the elbow. Put on new slippers. Wash your hands with soap and water following the essential steps of hand washing. Put on a sterile half-sleeve gown. Keeping the bed of the baby and the surrounding area clean is an important step in preventing sepsis. Remember, the bed is to be prepared before the baby is admitted to the neonatal intensive care unit. Use the prepared Basilocid solution to clean the bassinet of the radiant warmer. The side panel of the warmer should be cleaned with soap and water. Thereafter, wipe both the bassinet and the side panel with a dry cloth. After drying, take an autoclaved baby sheet and spread it over the bed. Use another sheet to prepare a boundary for the baby. Clean the temperature probe of the warmer with a spirit swab. Switch on the radiant warmer. And now the bed is ready to receive the baby. After this, the baby's belongings, that is the stethoscope, the measuring tape, the containers with betadine and spirit and the thermometer should be kept alongside the radiant warmer. Note that each baby has a separate set of all these items: the stethoscope, the measuring tape, the thermometer, the blood pressure cuffs, the probe of the radiant warmer, of the incubator, the probe of the pulse oximeter should all be cleaned daily with spirit swabs. Daily, clean the swab containers with soap and water and send them for autoclaving. After you receive them, put autoclaved cotton balls. Pour betadine and spirit into each container to prepare the swabs. The syringe pump should be cleaned daily with wet cloth. If there is blood stain on the syringe pump, soap and water can be used. The oxygen hood has to be washed daily with soap and water and then wiped with an autoclaved cloth to make it dry. Change the sterile water in the oxygen humidification chamber daily and sterilize the chamber by putting it in 2% glutaraldehyde for about 4 to 6 hours. Now you will see the disinfection method for ambu bag, the face mask, the reservoir, the oxygen tubing, the bottles and the tubing of the suction machine. All of them should be first cleaned with soap and water and then immersed in 2% glutaraldehyde for about 4 to 6 hours in case sterilization is required, and for about 15 to 20 minutes if disinfection is to be done. After that, rinse in distilled water. Then dry them and wrap them in autoclaved linen and remember to put the date. Clean the laryngoscope with spirit swab thoroughly, daily and after each use. Wrap in an autoclaved cloth, put the date on the cover and then keep it aside. If used for an infected baby, wash it with soap and water each time. Remove the bulb and put the blade in 2% glutaraldehyde. Wash thoroughly after removing from glutaraldehyde solution. Feeding utensils like palade, katori should be washed thoroughly before and after each use. First with soap and water and then left for boiling for about next 20 minutes. Regarding the ventilator tubings, they should be first cleaned with soap and water and then immersed in 2% glutaraldehyde. Keep them in the solution for about 4 to 6 hours and then rinse in distilled water. Hang the tubings to drain water. After they are dry, Wrap in autoclaved cloths and remember putting the date. This item can be used for up to 72 hours, after which it has to be cleaned or re-autoclaved. Clean the weighing machine daily and before and after each use with 2% bacillocid. Remember, the autoclaved sets which are not used for the procedure which they were meant for have to be sent for repeat autoclaving after every 72 hours. Autoclave the Cheetle forceps daily and again wrap it in an autoclaved cloth and label the date. The walls of the unit should be cleaned with 2% bacillocid at least once in each shift. The floor is cleaned with diluted phenyl in each nursing shift and also when it is required. Remember, only wet cleaning should be done and dry mopping should never be done in the unit. Fumigation of the nursery should be done with 20% EcoShield solution which is commercially available, and for the routine fumigation of 1000 cubic feet area of the nursery, we require about 200 ml of EcoShield, and this is to be mixed with 800 ml of water. Nursery is to be sealed properly, the AC has to be switched off and the duct has to be sealed. Take the required amount of EcoShield and water in a fogger and switch on the machine for about an hour. Open and clean the nursery after 6 hours. Visitors should be restricted inside the nursery. Only the parents of the babies should be allowed entry into the intensive care unit. Mothers are welcome any time that they want to. They can come every 2 to 3 hours to the baby care area. Fathers should be allowed at the time of admission to the nursery, after stabilizing the baby, during the hospital visiting hours, or when the newborn is sick. Fathers should be allowed especially after the rounds or at a convenient time in the unit. The parents need to be guided and supervised about proper hand washing techniques in the nursery. Always use sterile gloves for invasive procedures like sampling, starting intravenous lines and giving intravenous injections. For invasive procedures like lumbar puncture and blood exchange transfusion, one should always wear a full sleeve gown and mask and a cap. The intravenous sets needs to be changed daily or as per the set routine of the newborn care unit. Feeding tubes, however, can be left alone as long as the baby retains them. The temperature of the nursery should be maintained between 28 to 30 degrees Celsius and the environment should be calm and clean. Some do's and don'ts. We should avoid overcrowding in the neonatal intensive care unit. Do not use a single saline or a dextrose bottle for more than 24 hours in the unit. All the injection vials and the bottles of syrup should be labeled with the date and the time of opening. Antibiotic vials have to be changed after 24 hours and the syrup has to be consumed within 1 week of its opening. Do not keep fomites like files, X-ray films or pens on the baby cot. The following steps help to remove nosocomial infections of the babies admitted in the intensive care unit. We should avoid overcrowding. We should adhere to all aseptic precautions for the invasive procedures. We should avoid unnecessary administration of intravenous fluids, and last but not the least, we should promote breastfeeding. By doing all this, we can reduce the nosocomial infection to a significant extent in our unit.